Hello and welcome back. In today's video, I'm going to tell you a story about one of my new patients who was referred to see me for depression, but she also has a couple of anxiety disorders. She has been diagnosed with ADHD and she questions whether she needs an assessment for Autism Spectrum Disorder. My name is Dr. Ruben Gagarin. I'm your favorite family psychiatrist, and in these videos we try to look beyond diagnostic criteria of DSM to understand the complexity of mental health challenges. Let's dive in. My real patient's fictional name is Maria. She's 15 years old. She was referred to me because she was having sadness, depressed mood. She lost motivation, energy. She felt very hopeless and occasionally had suicidal thoughts. For the first time in her life, she failed one of her high school credits. She told me that a couple of years ago, she was diagnosed with ADHD and was prescribed medication called Vyvanse. She benefited from it, meaning that her focus got better. However, she experienced some sort of euphoria. Most of the day she felt sort of buzzing and she had a lot of energy, but then she crashed, and over a period of few months, she felt as if she was feeling more anxious and depressed. At the time when she came to see me, she was not taking any medications. As long as Maria remembers herself, she has always been an anxious person. She was eager to please, she worried about what other people think about her. She was very shy and avoided social situations. However, once she got comfortable with people around her, she craved that social interaction. She developed a passion for music. She loved dancing and singing. So she tends to do that on her own, but she has a really hard time connecting with other people to share her experiences. She is unable to present in class, or when she forced to do that, she feels very uncomfortable, tends to mumble, and cannot shine on a stage. Interestingly, she told me that for quite some time now, she has been thinking that she might have autism. When I asked her why, she said that because she feels awkward in social situations. She has been told by her family and friends that she's weird. When I asked her what that means, she told me that she does not know how to express her feelings in her face. Her family told her that she speaks in such a way that it's hard to understand what point she's trying to get across. As a result, she isolated herself even more and stopped connecting with others. When I asked her what would be different if she had a formal diagnosis of autism, she said that it would give her some relief and explanation for her difficulties. Maria also told me that she worries excessively about various things. She worries about safety of her family. She has a hard time falling asleep because she worries about the following day. She has a very hard time concentrating on tests or exams. And essentially she met criteria for generalized anxiety disorder. So if you look at what we already know about Maria, she meets criteria for social anxiety disorder, for generalized anxiety disorder, and she had a thorough assessment for ADHD and was diagnosed with ADHD and attentive type, and even benefited from treatment for that condition. However, she noticed herself that she was socially awkward and she has difficulties expressing her emotions or perceiving social cues. Let's step back for a moment and let me ask you this question. What is the purpose of a diagnosis? Well, the purpose of diagnosis is to put a label on something, on a problem, then to do research and understand how we can solve this problem. Now, for example, for ADHD, there is evidence that ADHD medications, especially stimulants, help the ADHD symptoms or may even completely alleviate the problem. Similarly, there are medications and psychotherapies for anxiety disorders and depressive disorders. What is autism? Autism is a developmental condition. ADHD is also a developmental condition, but autism affects different area. It is more kind of global. So this condition affects people in such a way that they cannot relate in social situations. They don't use non-verbal cues. Their tone of voice does not always express their feelings. They also have really hard time understanding social situations. For instance, when I talk to a person with autism, they frequently may look behind me or on something else instead of making eye contact because they just don't feel that this is what they need to do to look at my face to understand better what I'm saying. I'm not going to go over all the diagnostic criteria. You can easily find it online. Interestingly, my patient, Maria, she said that she actually understands that other people look at her and see her as if she's weird. That is kind of puts a big question mark. So when she finds herself in social situations, she actually perceives pretty well that she is not fitting in. I remember one of my patients from years ago. One time he found himself walking in a room full of people sitting in a circle in a meeting, talking about something that has nothing to do with him, but he didn't realize that he was out of place until he almost walked into the middle of the circle. And then when he realized that this is not the room where he was supposed to be, he sort of backed away. He started walking backwards, and the whole situation was obviously very awkward. But I don't think that he noticed it himself. That's what I told Maria. The fact that she understands that other people see her kind of weird, and also that she feels the pressure that she needs to do something with her face or with her body language to fit in better, essentially makes it very unlikely that she has autism, because at the core she understands, she just doesn't know how to fit in socially. Now, is there another explanation for her difficulties? Well, of course, ADHD can affect a person's ability to pay attention to the conversation. I spent good half an hour talking to her about different options, and I made sure that I repeated the options a few times in different words, but at the end she told me that she just doesn't quite remember what I told her, because her mind constantly was switching on, off, on, off, on, off. So she couldn't keep a thought in her mind long enough to understand what I was trying to say about the treatment. She also obviously had social anxiety disorder, meaning that when she found herself in the social situations, instead of just naturally in a relaxed way using her body language, her tone of voice, and communicate some ideas, in the back of her mind she constantly was preoccupied thinking about how other people see me, what should be my facial expression. And I can't even imagine how much brain power this kind of processing would take. So she has difficulties focusing and paying attention in the first place. And then on top of that, whatever's her mental power is, she has to divide into analyzing what is happening, and that there is very little left to stay focused on the thought to express herself. So what were the recommendations for Maria? Well, first of all, we have to identify what is our main priority. And that is actually very difficult, because on one hand, she told me that she would like to focus more on anxiety. When I asked why, the reason was not because she suffers from anxiety more, it's actually depression that troubles her the most, but she was concerned that if I prescribe her an antidepressant, she would become addicted to it. Of course, that is not accurate. If you start focusing on depression and anxiety, then besides medication, she's also going to need counseling and psychotherapy. Maybe group, maybe individual, but the problem is she cannot stay focused for half an hour in a conversation. So how is she supposed to benefit from therapy if she doesn't remember what happens in the session by the time it is over? So I was tempted to maybe restart her in the medicine for ADHD so she can focus on developing coping skills and psychotherapy. If I do so, then her anxiety may get worse, because stimulants for ADHD, they also stimulate anxiety. What did we decide? Well, we decided to start with antidepressant. I recommended Cipralex or Prozac. Those are good first-line treatments. I thought that it may be a good idea to start with a small dose to see how she responds, because she also told me that she's sensitive to side effects. What I'm thinking that sooner rather than later, I would want to add a medicine for ADHD and in the meantime refer her to counseling. I strongly encourage her to think about group therapy, because she isolated herself, but naturally she's actually a very social person. So she feels very lonely, and I thought that she would benefit more from a group setting. Group setting would also potentially help her to focus better and learn coping skills, not only from a therapist, but also from her peers. Considering that one of her main complaints is also low energy and low motivation, there is a possibility that besides medication like Cipralex or Prozac that helps to increase level of serotonin, She may need another medication that may increase level of norepinephrine and dopamine to help her with those symptoms, but that is sometime down the road. In summary, Maria's story illustrates the difficulties and complexities of real-life mental health challenges. She has always been an anxious person, shy person, and she has always had ADHD, but she was able to compensate until a couple of years ago. And when she came to see me, she was failing socially, she was having a lot of hopelessness and lack of energy, and started failing academically as well. So you see how sometimes it is difficult to prioritize the right symptoms to address and the right diagnosis to treat. We decided to put the autism assessment to the back burner because to me it seems as if her symptoms are more explained by depression, anxiety, and ADHD. That's something that we can treat. So I told her that for 6 months, let's focus on these conditions and then consider assessment for autism. At the end, I'd like to emphasize that if you suffer from mental health challenges, depression, and especially suicidal thoughts, give a call to 988. That is suicide prevention line. If you need an assessment for ADHD, depression, and or you think that you need medication or psychotherapy, go to see your family doctor. You can also access a lot of online resources for counseling. Thank you very much for watching. I'll see you next time. Bye-bye.